Hi, everyone. My name is Katie Brumfield, and I am the Colorado School Public Health Career Services Specialist. And today I'm talking with Kristin Milardo. Kristin graduated from our school in 2018 with her master's in public health in physical activity and healthy lifestyles. And Kristin also received her degree, a master's in urban planning at the same time. Hi, Kristin.
Hi, Katie. Thanks so much for having me today.
Yeah, thanks for joining us. I'm really excited to hear about what you've been up to. And if you could just start off by telling us what's your current job title and where do you work?
Sure. Yeah. So I'm the workplace wellness strategist at Denver Health. For people who don't know, Denver Health is a comprehensive integrated organization. We provide hospital and emergency care to people regardless of their ability to pay, which makes us what we call a safety net hospital. And so in my role, I oversee Denver Health's employee well-being initiatives, and my role is part of the human resources department. And so I'm part of the total worker health team. And so I get to work with employees who work on ergonomics, leave of absence, benefits, and well-being. And we really take a total worker health approach to everything we do. And so the best way that I describe my job and kind of what that looks like is I take care of the people who take care of our patients through our well-being initiatives and well-being programming. Yeah, and so like I said, we really try to support the whole employee through this total worker health approach. And our well-being initiatives focus on physical well-being, mental and emotional well-being, financial well-being, and social well-being. And we're really just trying to foster a supportive, culture at Denver Health, a culture of health and well-being.
Wow, that's so cool. I love the total worker health stuff. I think it's so fascinating.
Yeah.
How big is your team that you work on? Because Denver Health's pretty big, right?
Yeah, we're a very large
Yeah.
organization. Denver Health employs close to 8,000 people across the entire organization. The Human Resources Department is made up of about 60 employees, and then my immediate team, the Total Worker Health group, is about 10 people big. So really great team. Yeah.
Oh, that's awesome. Could you describe what a typical day looks like in this role?
Yeah, well, it's changed a lot over the last 2 years, as you can imagine.
Mhm.
But like I said, I support our employee well-being initiatives. And so that ranges from, managing our on-site fitness center to working with multidisciplinary teams to ensure a healthy food and nutrition environment, to supporting our benefits teams and getting information about employee benefits out to staff. So it varies a lot. Working in a hospital setting is really exciting. I get to be out there in the hospital supporting our employees. Sometimes I'm behind a computer screen most of the day, like today working from home. So yeah, it's different every day, and that's what makes it really exciting.
Nice. What are some initiatives or things you've been involved in that you're really proud of?
Um, there's a lot of things that I'm really proud of. I love working for Denver Health. Like I said, we're a safety net hospital. And so just everything about our mission and kind of being an anchor institution for the community of Denver is really rewarding. So there's a lot that I'm proud of. I get to work with a lot of incredible people. But a couple of things that I'm most proud of. I'm really excited and happy about the work that I've done to ensure a healthy food and nutrition environment at Denver Health. So I was part of a multidisciplinary team that helped to phase out the sale of sugar sweetened beverages from all Denver Health locations and clinics. So back
Wow.
in 2018, Denver Health eliminated sugar sweetened beverages. So we no longer sell or serve them to patients, visitors, or staff. So that's one initiative that I'm really proud of.
Yeah, that's amazing. Oh my gosh. Yeah, that's Great. Wow.
Yeah, we try to be a good example for other institutions similar to us. We participate in CDPHE's Healthy Hospital Compact. And so I know a lot of other hospitals in the region and even in the Denver metro area have kind of looked at what we've done with eliminating sugary beverages and have reached out and asked for best practices and just to kind of learn what we did. So we're really proud of that work, and we're proud to help other hospitals do the same thing.
That's so cool. Um, what challenges have you faced in your role?
Yeah, so as you can imagine, working in a hospital setting during a pandemic has been a challenge in and of itself.
Yeah.
The nature of my job in many ways is to take care of our caregivers. And so,
Sure.
supporting the employee and their whole family's health and well-being through what we do, their physical, mental, financial well-being, all of those things. And so, all of those areas of well-being have really been challenged these last 2 years. And so the impact of the pandemic is going to continue to challenge that. And so, supporting people through this tough time is challenging.
Yeah.
Hospital and healthcare staff, particularly our first
Yeah.
responders. A lot of people might not know, but the Denver paramedics, those are Denver health employees. So we
Oh,
support
wow.
our first responders, those frontline workers, and they just face so many challenges in their job right now. Always, but it's just been compounded during the pandemic. And so that's been hard.
Mhm.
And the pandemic has really changed the way people work. So when we think about total worker health and employee well-being, a lot has changed, and we've had to pivot and kind of rethink a lot of our employee well-being strategy. For example, prior to the pandemic, Denver Health didn't really have a large remote or teleworking workforce, and a lot of that has changed. And
Mhm.
so many people, a lot of departments, a lot of teams are either working from home sometimes and they never were before. Some teams are 100% work from home and don't come to campus at all. And so just kind of the way we work has changed. And so that's challenged us and allowed us to need to
Yeah.
pivot and rethink our strategy. So those are some of the challenges that we're facing.
Yeah, that's a really good point. Gosh, I'm so thankful, and I think a lot of people are so thankful for first responders and medical staff, and I just hope that they're being taken care of too. So
Yeah, we're
that's
really
nice to
trying to
know.
support their resilience and eliminate provider burnout.
Yeah,
That's something that's been a problem kind of in this world even before the
sure.
pandemic. And so those things have just, become that much more important.
Yeah, your job's really important.
Oh, thank you.
Yeah. How would you say the Colorado School of Public Health helped prepare you for this job?
Yeah, I don't think I would be here without, my time at the Colorado School of Public Health. Definitely prepared me for this role. Obviously the coursework, so
Mhm.
things like understanding how to work with data, how to analyze data, how to visualize data. Those are super important skills that I use probably almost daily. Some other coursework that comes to mind, the health promotion program planning. Those are skills that I use daily as well. A lot of skills related to survey design and survey dissemination are really important and really useful to my job now. So those are kind of some of those like tangible skills like from the courses, but I would say that the School of Public Health really prepared me for this job, mostly through like these practical experiences that we get the opportunity to participate in. So things like the practicum and the capstone. I actually completed my practicum at Denver Health
Oh, I didn't know
with
that.
the person who is my supervisor right now. So we've been together for a while.
Yeah.
And so, yeah, that opportunity obviously set me up for where I am now, but I think it was that practical experience that gave me the skills that I really needed to have a career in workplace wellness and total worker health. And so I'm just really grateful that the Colorado School of Public Health not only requires that, but
Yeah.
provides that support and provides that opportunity to get that experience and learn those practical skills that way.
That's awesome. I do want to touch on your dual degree. So I think the Masters of Urban Planning with the MPH is so cool. What brought you to that dual degree, and how have you used both of those in your job?
Yeah. So while I was at Colorado State working on the physical activity and healthy lifestyle concentration, I had a lot of really great people around me who were interested in the same thing. Guest speakers who would come into classes, my advisor and professor, Dr. Chrissy Chard. And as I was kind of going down this path in the coursework and trying to figure out what I was interested in, it became so apparent to me that our built environment, our physical environment, impacts our health and well-being so much. And I really wanted to know more about that and learn more about that. I knew there was this inherent connection between, city, urban, and regional planning and public health. And I really wanted to be, in those conversations and part of that work. And so I learned about the dual degree program and started that. And I think it's really important in urban planning or in any type of community planning to have someone at the table who is kind of the voice of public health and the voice who can come to those conversations with population health in mind. And so those are some of the reasons that I wanted to go down that path. But in what I do now at Denver Health, I use some of those planning skills here and there. So thinking about patient, visitor, and employee safety around our campus. So that's a couple ways that I've gotten to kind of bring in my urban planning background and thinking about active spaces and how the spaces that we occupy, where we live, work, and play, impact our health.
Yeah, that's so cool. I didn't even think of that. But yeah, Denver Health is you have a landscape, right? Like that so many people are at. So you have to think of the area. Wow, that's really cool.
Yeah.
Were you always interested in total worker health? How did you fall into that? Because we do have a concentration in that and a certificate in it. So I was just curious.
I don't know if the certificate in total worker health existed when I was there. I probably would have pursued it if it had, but I just think through my coursework and kind of through it all, it became so apparent that, we spend the majority of our time as adults at work. Same goes for kids in schools. Was passionate about school-based health as well. And so if we're occupying and spending so much time in these places, it's so important that those are health promoting environments and that the policies and the programming and really the culture of those places support a person's health and well-being. So those are some of the reasons why total worker health.
Yeah, no, and it makes a lot of sense. I don't know when that certificate launched at our school, but what I like about your story is that it shows that a degree in public health really is transferable, and you can use it in different areas.
Yeah.
So that's so cool. What advice would you give for prospective students or current students looking to do the work that you're doing?
Yeah, that's a great question. I think for me, my best advice would be to tell folks to just talk to people, have conversations and make connections, meet people who do things that you think you want to do. Things like conducting informational interviews or, just taking the time to learn about people's roles, whether that's in a conversation or if there's a volunteer opportunity or, an opportunity to shadow or intern. Like I said, through this Colorado School of Public Health, it was those like practical experiences that I think were really valuable. So if there's ever a time to, shadow, intern, volunteer, things like that, I think that's really powerful and kind of gives you that understanding of what the work looks like and kind of what some of those best practices are. I think the world of workplace well-being and total worker health is an evolving one. And so just trying to stay abreast with what's going on and with best practices in the industry, especially locally, is a really good idea too. So if folks can listen to webinars or podcasts or try to attend some conferences. I think that's a great way to, like I said, stay abreast with those industry best practices and kind of continue your learning and continue your education, even once you've completed your degree.
Yeah, and if you are interested in total worker health, that certificate would be a great add-on for you
Absolutely.
to
Yeah.
learn more about it. Yeah, absolutely. Well, thank you so much, Kristin. And it was so nice chatting with you. Thank you for all the amazing work you're doing in public health. And I'm excited to hear about all the more initiatives you do. And yeah, thanks so much.
Yeah, Katie, thanks so much for having me. It was fun to get to share a little bit more about Denver Health and what we're doing to support employee well-being. So thanks for the opportunity. I appreciate it.